Hi everyone. My presentation is on the homelessness and healthcare epidemic in the United States. According to Blackstock, homelessness is associated with significant unmet healthcare needs and an increased risk of morbidity and mortality. For some people, a lack of healthcare leads to homelessness, and for others, a life of homelessness can lead to a lack of healthcare. In order to solve the homelessness and healthcare epidemic, we must address both of these issues simultaneously. According to Martin, one of the leading causes of homelessness in the United States is the result of chronic mental health disorders suffered by the severely mentally ill. Some of these conditions include schizophrenia and bipolar disorder. Substance use disorders also fall under this category, which predominantly affect minorities, especially African Americans, which Blackstock tells us. He also states that the number of homeless veterans is disproportionately high. Veterans left permanently physically disabled in combat or left with lasting mental health conditions such as PTSD and depression may find themselves unable to work, which can prevent them from being able to afford a home or health care for their conditions. While homelessness can affect anyone, it is known to be more common among men, and perhaps this could be due to the stigma surrounding men seeking help for mental health. On to the overview of solutions. The solution to the homelessness and healthcare epidemic is actually rather simple in theory. We need to, 1, provide homeless people with homes, and 2, we need to provide homeless people with adequate healthcare. This plan might seem too simple to work, but fortunately, we have an example of an entire state that had great success following this plan. The headline, Utah reduced chronic homelessness by 91%, here's how, pretty much says it all. According to McEvers of NPR, Utah implemented Housing First initiatives to address the homelessness epidemic. In the past, homeless people seeking housing assistance would have to get clean or sober prior to applying for housing. This is very difficult to do, as the challenges presented to an individual by homelessness, such as food scarcity, poor weather conditions, and easy access to drugs, push homeless people right back into their addictions, making the recovery process next to impossible. There's a lot of opposition to the solution. Many people argue that providing homeless people with housing would be too expensive. However, according to McEvers, simply providing homeless people with housing would save the taxpayer money because we as a nation spend more on treating homeless people when they suffer medical events related to their living situation than we would on actually housing the homeless. And for many, this solution prompts the question of fairness. The idea that if I have to pay for my home, why shouldn't they? Lloyd Pendleton felt the same way, but after attending a conference about homelessness in Chicago, he became the director of Utah's Homeless Task Force and implemented Housing First initiatives statewide. His reasoning? It's cheaper for him and everyone else to do this. And if the solution benefits everyone, it might be okay that the solution isn't necessarily fair. Now, some cities have implemented Housing First initiatives, but have not had as much success as Utah, likely due to Utah's small population size, support from religious groups, and agencies and advocates that work well together. We need to pay more attention to proposals from agencies, like the Center of Budget and Policy Priorities, and distribute federal funding to the states that need it most, who might not have Utah's unique advantages. Many people believe that universal health care contributes to long wait times as well, because fewer people will want to be doctors since they will get paid less as a government employee, since they'll be paid by taxes and people in the US frequently oppose tax hikes. However, we could increase taxes slightly and still manage to pay doctors and other healthcare providers at a rate consistent with what they make now. We can also remove some of the costs associated with medical school, freeing doctors and nurses of the financial strain of student loan debt, which will allow them to accept lower wages. We could also reallocate funds used in other areas of their government's budget. In order to prevent future homelessness and healthcare inaccessibility, we have to establish new laws and policies. A current challenge to the availability of affordable housing is zoning boards. Houston, a city without a traditional zoning code, experienced a 63% decrease in total homelessness because lower-cost housing was easier for the government to find and purchase. Cities like San Francisco actually experienced an increase in homelessness because more people are being priced out of these cities with strict zoning regulations on where houses can be built and what types of housing, like manufactured cookie-cutter homes, tiny homes, and co-living units, which Calder and Geige tell us. Essentially, we need to have the lowest level of zoning regulation possible in order to build more affordable homes. We can also consider placing limits on the number of properties a single person can rent out, which will prevent monopolistic landlords. The United States is also the only developed country in the world without a universal healthcare system, which Healthcare Now tells us. If we implement universal healthcare, more people will be able to access it, which can prevent people from becoming homeless due to inability to work or due to the cost of medical bills. And that's all. Thank you so much.